Minister, thank you for the opportunity to participate in the debate. It hadn't been my intention at the outset of the debate to mention the briefing that we received today from the CARE group, but such was the moving personal testimony we received there from people who had suffered from eating disorders and from family members. I think it would be unbecoming not to mention having attended the briefing. And I know that we became much more aware of it today for those who attended. Many there were already very familiar with the whole issue and area of eating disorders. But I think it is an area where there is a specific ask, and that is for specific treatment and therapies to be provided outside possibly of the standard acute mental health facilities for those who suffer from eating disorders, and it would be remiss of me, having attended that, not to raise that issue here tonight. And just to note an issue mentioned by my colleague here across the floor regarding the issue that is contained, or the objective contained in the programme for government to introduce tax incentive or tax credit for those who join gyms. I would say that we shouldn't be so narrowly focused on that, and that if we are to look at that, and it obviously would have a lot of public health benefits, that we should also look at extending such a break to those people and families who, enlist their children in their local GA club, their local soccer club, their local rugby club, whatever it is that promotes physical activity, that we wouldn't have that narrow focus around gym membership and the credit only applying to that area. I think that would be important. At the outset of our contribution tonight, I heard the Minister speak of a lot of capital investment in the whole healthcare area, and terms such as outpatient departments, primary care centres, trauma centres, surgical hubs, elective hospitals, increased bed capacity. They're terms that we're all familiar with. I've been a member of the Regional Health Forum in the North West Regional area for the past 5 years, and I've heard a lot about these, specifically in relation to my own constituency, Galway West, and development of such facilities, all of which were very welcome. And Minister, I welcome your initiative and I suppose your determination to see them through. I would have to say it can be very frustrating following those processes and bringing those projects to fruition. And such an example I saw in my own constituency when the government decided that they would develop an elective hospital in Galway. In Galway, there is a site where there is currently a hospital in Merlin Park. I'm sure many people are familiar with it, 60 acres. But when the decision was made to develop an elective hospital in Galway, the local health officials were obliged, I understand, to put out a call among the general public to see where or what site could be used to develop that hospital. That was a 3 to 6 month unnecessary process as far as I was concerned. The state held land, the Department of Health held land that could have facilitated it. Now the decision was eventually made that the elective hospital would proceed on the site of Merlin Park, which is very welcome. But that decision didn't need that process. It didn't need that 6 month delay. And that's the type of, I suppose, bureaucracy, Minister, that I'd hope that you would challenge, and I would be confident that you will, and you will have our support, I think, should you proceed to do that. The second topic specifically I wanted to touch on tonight is the whole area of staffing. And we've had statements in the House over the past week on mental health, statements on disability, and tonight statements on health. And in each of those debates and statements, there's a reoccurring theme, of the challenge it is to recruit and retain staff in the whole healthcare sector. We hear of lack of therapists, lack of GPs, and other such positions. The Minister for Enterprise and Employment has advised me that last year there were 17,168 critical skills work permits issued across the employment sector in Ireland. Some 35% of them, almost 6,000, were in the health and social work sector. And it seems to me, Minister, that there is a challenge in us training people to work in our own public health care sector in Ireland. And I think that must be something we challenge as well.